That's always it's a tricky word because you're always like, well, is this really a trend, or am I just sort of in my mind, or I think I see more of this now because it's summertime? Definitely, I think that we are seeing a lot of what I call body matchup. All right, so people are taking care of their skin. They're getting to daily facial routines. They're getting their moisturizers, their exfoliators at night. They're coming in for their microdermabrasion, their chemical peels. And gradually over time, they've maintained their face. Obviously, it's the first thing people see. So what happens if a year after your regimen, you turn around, you're like, okay, my face looks good. My eyelids are nice and fresh. I don't have any wrinkles. My laugh lines are gone. And then the body doesn't quite match up. I think that's what we're seeing. So now we have people who sort of plateaued on the facial, and they've got good maintenance, and they're happy with where they are. But the body just doesn't match up. The body's 10, 20 years older than the face. We have what we call circumferential body lift, which includes a tummy tuck, a thigh lift, where the sides of the thighs are pulled up to get rid of those the saddlebags, and it includes a butt lift. So you sort of have a belt excision of skin, and you take care of 3 different areas at the same time. And that whole body lift it's extremely popular with patients who've lost a lot of weight. But we are seeing it also in patients who want the entire body to match up. They don't want to have a flat stomach and have a droopy butt, or have a flat stomach and have large saddlebags at the side of their hips. So they're trying to get the body essentially to catch up with the face. I think it really depends on the patient. Sometimes it's a huge hit to do several things at the same time. And the other thing is sometimes you can do one thing at a time, and people get encouraged. You do the face, and all of a sudden they have a brighter outlook and a brighter perspective. Like, wow, I look good. If I fix one more thing, I'm just adding to the package. And it may be daunting sometimes to try to tackle everything at once. But definitely we have cases where we'll do 2 or 3 different operations at the same setting so that they have one long recovery and they're done. And there are people that opt to get little things done. I just want to do my chin. Very popular way to start. It's sort of like the introduction to cosmetic surgery. Is it really for me? How do I feel about getting something done to change, to alter my body? And they get a laser liposuction of their chin. And 2 weeks later, the neck is smooth, the chin is smooth, and they're like, well, okay, that wasn't too bad. I can now tackle some bigger things like my belly or my breasts.